Third chapter was more of your suffixes. Now in continuation of this is the next chapter that is known as prefixes. Volume 1 will have a foundation for you to learn all these basic terminologies so that when we get into individual systems this is easier. Alright. So we are talking about prefixes. What all you have? Introduction. There are some more combining forms and suffixes, prefixes and terminologies, and there are some appendices, means some diseases are explained. Then comes your exercises, which is important. Alright, so scroll down. We go to the first one, and there will be first right now is in your next page. You will have your different combining forms. I am going to explain some basics. What is there? Along with that, some relevant topics which you are going to see next. The first word is carpo. Carpo means wrist bone. So related term. I will give you two terms in this. Carpal means. You can write down as I am talking. You need to write down in your book as I am telling. Carpal is pertaining to wrist. This is carpal. Alright. Now, metacarpal. Right, next terminology. Metacarpal. Now, what is metacarpal? Meta means beyond. Okay. So, meta is beyond, pertaining to beyond the wrist bone. We have 5 metacarpals. Alright, you can listen right now. If you see, what is carpal? Wrist. So, these bones, which is your thumb, your index, middle, ring finger, all those fingers is known as first part of the bone is known as metacarpal. Beyond that is phalanges. Phalanges, we call this small, this is there, no? That is known as phalanges. Phalanges spelled as PH. Phalanges. So you have carpal, metacarpal, phalanges. Okay. In this carpal, we have usually a corporate world or a typing who do lot. They have a syndrome that is known as CTS. You can write CTS, that is carpal tunnel syndrome. You will read this again in musculoskeletal system, but I am giving you once more a heads up for that. That is known as carpal tunnel syndrome, CTS, not cognizant. Okay. Now what happens here is, somebody who is typing continuously, there is a nerve that is known as median nerve that gets compressed. That is why you will have tingling sensation or a numb sensation and pain when you are working. Do you get the idea? Okay. Then they give the different treatment. SIBO. Did you have your SIBO today? Manju.
SIBO. Uta.
Meal.
Meals.
Now where will the meal part come here? In medical?
Digestive.
Will you say SIBO? No, right? Have you seen in your prescription when the doctor gives to you, they write as AC, PC and all.
After meal, before meal.
After meal, before meal. AC is ante-SIBUM. SIBUM meaning pertaining to before food. AC, ante, A-N-T-E, SIBUM. PC, post food. Karthik, you are with me? Alright. Cis. I think so we have gone through this before. To cut. So what is the word? Incision, excision, resection. Alright. Costo, rib. Now 3 words will come here. Costal is pertaining to rib. Intercostal. Intercostal means between the ribs there is muscles which helps in our breathing. Intercostal. Okay. Hypocostal, you can have different one. Cutaneo is also known as skin. The other word for cutaneo is dermo. You can write a word dermo, D-E-R-M-O. Dermatology, right? Subcutaneous. Cutaneous can be used as subcutaneous. When they give these injections or stuff, like some insulin injections and all, what they do, they give subcutaneous just below the upper layer. That is known as SCs. Then they can give us intradermis or in the muscle, IV, you will read now in the future. IM means intramuscular. IV means intravenous, through the vein. The vein is the fastest. Even more faster is lungs. You get the idea? Faster way of it. I'll teach you when you read the next chapter, that is cardiovascular system, how the entire circulatory system works. Hence the medicine works also in that way. Right? Ductile is finger or toes. Your finger or toes will come. Synductile, S-Y-N, synductile will happen. What happens, I was talking in the previous chapters, that there is a multiple organs, everything in formative stage, especially when a child is born. Sometimes what happens, the child worms will have a webbed finger. Synductile means they will have like a Spider-Man, frog or something, no? The webs are not open, it is half closed. That is known as synductile, known as webbed fingers. Okay. Duct, you know, to lead. Flex is to bend. Flexion, I think you will get as anti-flexion or something. Action means bending forward. Advaita Swami or Kalagudde, when you want to take some blessings, you should do flexion. Anti-flexion, bending forward. Furco is forking or branching. Like trachea will come and bifurcate into two branches. Okay, we will read in the respiratory system on that. Bifurcate. Glosso, tongue. Simple. Then glyco, get me some glyco. Sugar. Hyperglycemia, all that. Immune is protection. I think you read in the previous chapter how our immunology is developed, right? Then morpho is shape. Where is the morpho will come? Morphology. The shapes of the nucleus of your WBC cells, right? Polymorphonuclear. You have the PMN cells, right? So like that, morphology is studied in that way. Scroll down.
Can we take an example of biometrics?
Which one?
Biometrics.
Morpho. Why is morpho and biometric coming here?
Because it takes the shape, right? Of fingerprint shape or something.
Morpho is shape of the nucleus or the shape of an organ. Metric here is with respect to biometric. Here what you use is pertaining to the living readings of a person whom you take. That's all. That is biometric. Okay? Not a medical terminology as such. It's a simple English meaning. Alright? Then going to mort is death, mortal, immortal, those who think they were not going to die, right? Net, to bind or to tie or to connect, like connective tissue. Neck here is connective tissue. Which is the biggest connective tissue that we got? Blood. Blood is a connective tissue. Okay? Normo is rule or a order that needs to be followed. Normal pertaining to a particular rule. Abnormal or a particular order. Abnormal pertaining to away from the normal. Is known as abnormal. Oxo is oxygen. Sepso, sepsis. Somno, sleep. You can write insomnia. Is a commonly used. Insomnia is lack of sleep. Usually, as the child ages, anybody who ages, their sleep tends to reduce. Okay. Sono, ultrasonic, like sound is sono. Sound we have. Going down next. Theo, to put in place. Telo, nipple, epithelial cells also. Thyro is a butterfly shape of your gland. Then a normal working thyroid is known as euthyroid. EU thyroid. Euthyroid. U means good or normal. EU. Topo, location or position. Topography is record of the position. Toxo is poison. Tracheo is the windpipe. Urethro is the organ that secretes out. Next, blast. I think so this you read it in the other suffixes. Going on to the next one, next part, suffixes. The next previous chapter you read about, anything that is immature is known as blast. Erythroblast will become erythrocyte. Get it? The more the cells get broken, lysis, before it matures, then you have erythroblastosis fetalis. I think so that you read in the previous chapters, right?
Correct.
Cysis is pregnancy. Okay, now tell me, cysis is pregnancy. What is pseudocyesis? Meaning of pseudo?
Another name.
Pseudo. What is your pseudo name?
False name.
False pregnancy. It can happen, right? Cysis is pregnancy. Partum, right there only. Partum is also.
Nearly.
But again,
Partum.
it is not related to pregnancy. You will always say cysis and pregnancy. Birth or labor is known as partum. You get it? I'll come to the word anyhow, it will come. Drome is to run. Syndrome. Write down syndrome is important. To run together, meaning a group of symptoms to run together is known as syndrome. Fusion, to pour or to come together. Gen is producing or forming, like antigen. Right? Antigen gives rise to antibody. Lapse. Usually this happens in the night shift people. Till 10 o'clock, 11 o'clock they will be sitting in their position. But after 11 o'clock the chair keeps going inside and inside and inside and inside. So what will happen? They will have a lapsing. That is fall, sagging. Ptosis, right down here. Everything is drooping. You can say drooping. Also known as ptosis. Ptosis in the sense P-T-O-S-I-S. Write down ptosis. P-T-O-S-I-S. Ptosis is also a lapse of the eyelid. What happens? What is in the eyelid usually in the position? It is in a relaxed state or a contracted state? Eyelid.
Relaxed.
Relaxed state? No, it is a contracted state. Because it is contracted, your eyelids are open. Whereas in some situation, it is going to drop like this. I challenge you to do this. Without moving this eyelid, this should be like this. Does it mean that I have ptosis? No, but somebody is able to do it. I think so in this Mahabharata, the Shakuni does this, correct? Doesn't mean I am the Kaliyuga Shakuni or anything. But having said that, ptosis means drooping of eyelid. Amitabh Bachchan, myasthenia gravis. He's got a disease that is known as myasthenia gravis other than the COVID currently. Alright, myasthenia means he has muscle weakness. Asthenia means weakness. Myasthenia, muscle weakness. His eyelids and all, if you see, it has gone down. He doesn't have it much open. There's a dangerous thing for him is, if at all if there is a baby in his hand, if he's lifting or something, he has a weakness. He can drop it. Any heavy objects he should not lift. Like that, that is known as in a muscle chapter we're going to read about this. Having said this, ptosis did you learn? Remember Shakuni. That only one eyelid he'll do like this. Though he doesn't have, he's able to do it. That's a skill. Alright? Slide or to prolapse. We also call it as prolapse. Here the word can be prolapse. Okay? Ptosis. Everything is same. Lysis is breaking down. Like in a previous chapter you would have seen that. Meter to measure. Mission to send, like transmission. OR is nothing but one who does it. Partum is birth or labor. Postpartum. What is postpartum? Post birth.
Labor.
Post birth or post labor. Phoria. It is a feeling or a mental state. I told you EU is good or normal. What is euphoria?
Good feeling.
Ah, correct. What is euphoria? Vinay is able to say this, which is recorded in this video, that he understands what is euphoria. Vinay, what is euphoria?
Good feeling.
Repeatedly this will be used. Tell me. Feeling of good well-being. You understand, somebody who intoxication which they do it, they feel that good state of well-being. That is euphoria. Alright. Physis is to grow. Symphysis means growing together. Like pubic symphysis means your pelvic bone will fuse together. That is known as pubic symphysis. Plasia is development or formation. I think so in your previous chapter you had this disease, achondroplasia. A means no, chondro means cartilage, plasia means formation. Lack of formation of the cartilage causes that person to be short. The short kind of a person, dwarf. Growth hormone, I said, if it is excess, before puberty it is known as gigantism, after puberty is known as acromegaly. Then, if the growth hormone is produced, no growth hormone, excess is what? That known as dwarfism. Similar to dwarfism is achondroplasia. You should be able to relate this, alright? In endocrine, we're going to repeat it. Class name is formation. We know what is PNEA?
Pineal.
Yes. Pronounce it.
Nia. Nia.
Pineal alla madhu. No, PNEA. It is not PENA. It's Nia.
Nia.
Nia. So,
Nia.
dyspnea.
Dyspnea.
This. What is DYS? Difficult or bad. Difficulty in breathing is known as dyspnea. It is an important terminology which you're going to read repeatedly. Person with COVID can have dyspnea. DYSPNEA. Dyspnea means difficulty in breathing. I told you that time before. Ptosis, right? Droop, sag or prolapse. What was the previous one? Prolapse. Sagging we have. We are repeating that, alright? Now go back on top, ptosis, go back on top. Ptosis was related to, I told you, lapse, to slide or to flag. So ptosis will come similar to that, to sag. Ptosis means prolapse, go down.
Lapse of eyelid.
Now prolapse can happen two different conditions. One, the eyelid, blepharoptosis, okay, or it can also happen is, see, everybody is supposed to stay in their own home as long as the walls are strong. If the walls become weak, they tend to poke into other people's business. Means it will prolapse. Means the organ from this state, it will go into the adjacent state. You're going to have some diseases which I'm going to explain to you because of the weakness of the wall. Myasthenia gravis, like I told you about Amitabh Bachchan, what happens? There is one more disease that will come into it. I'll explain to you. Okay. That time also the intestinal walls will be weak. That is where you have this protrusion of the organs. Alright. As you, because of injury it can happen or because of age it can happen. Okay. Rhea, not anybody's name. This is flow or discharge. Now what is diarrhea?
Loose motion.
Complete discharge. Diarrhea. You get the idea?
Because of the area.
So you need to stop it. That is known as stasis.
Stasis.
So we don't do diastasis. That is different. Not complete stopping. Stasis, you write hemostasis. Write on the word hemo. H-A-E-M-O. H-A-E-M-O. Stasis. Hemostasis is nothing but body's reaction for any bleeding. Hemostasis. Body will do what? If there is a cut, platelets will go there and try to block it. That state of this is known as hemostasis. H-E-A-E-M-O-S-T-A-S-I-C. Is to stop or to control the bleeding. Are you all with me?
Yeah.
Hemostasis. Next, trophy. Not that trophy that you win. Nourishments or development. There is two different types of it. Hypertrophy, atrophy, and there is one more, hyperplasia. I'll come back to that. Hypertrophy means excessive nourishment. Like when you go to your gym or something, is excess cells being formed or is the same cell being grown into big? Gym boy?
Same cells going into
Brain. Hypertrophy. Actually, you are trying to increase the same cell into a bigger size. Whereas there can be a condition that also, but is beyond that means there is a problem. But there can be a condition wherein extra cells are formed. So we're going to go down there and then we're going to find one more. Okay? That time that is also a problem that you have. Atrophy, no development or no nourishment. If you take a tape and then if you want to take your index finger and run the tape full tight as much as possible and leave it for a week.
Ischemia.
Totally. ISCO. Ischemia. I told that same thing. This one, there is no blood supply. There is no nourishment. Then what happens? This is going to completely come down. In fact, you leave it for more, it is going to necrot. Means necrosis can happen and it can drop off. To that extent, if there is no blood supply, it's something but you are not giving food for a longer time. So you are going to atrophy can happen. That is where what happens whenever this bedridden patients, bedridden in the sense, if they have any problem for 1 month, 2 months, if they are lying on the bed, the muscles and all will have atrophy. Means it will have actually any nourishments and they can't get up. Here and all they are okay, but because they don't move and they don't do physical exercises, the whole muscle will develop, especially the back muscle being very small, very little. Then they can't get up and they'll not be able to get up from the chair or they can't sit. They struggle, the old age people, because they are going on lying in one bed. If they don't move around, means there will be atrophy. Do you understand? So that is where movement for a human being is very, very important.